Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. Today's topic is understanding the Medicare Part A penalty and how you can avoid it. As you know, when you go on Medicare, you're going to be issued a Medicare card, and this is, of course, what they look like today. And original Medicare is broken up into two parts, Part A and Part B. Part A is called hospital, Part B is called medical. Pretty much A is everything inpatient related, B, pretty much everything outpatient related. But today's topic, all I'm doing is focusing on the penalties that could be associated with Medicare Part A. Now, there are two groups of people as we look at the penalties that are associated with Part A. So the question is, who will get penalized for Part A? Two groups are those who have 40 quarters paid into the Medicare/Social Security system and those without 40 quarters. As we work, we pay payroll taxes or FICA taxes. Part of that goes to Social Security, part of that goes to Medicare. And as long as we have paid in for at least 40 quarters, and most of you, by the way, have paid a lot more than that in, but at least 40 quarters, which is 10 years worth of work, you will never be penalized for your Part A, regardless of when you take it. But those who are without 40 quarters, you could be subject to penalties. Now, what we like to see happen is if you don't have 40 quarters, if there's some way you can get moved over into this column to do that, so you can get 40 quarters. Well, how is that possible? Well, number one, you can actually draw from a spouse. And so if you're married to someone presently and they have 40 quarters and you've been married for at least a year and they're at least 62 years old, you can draw from their benefits. Now, if you're no longer married, but were married for at least 10 years and that person is at least 62 and they have 40 quarters and you did not remarry prior to the age of 60, then you can actually go to that previous spouse and you can draw your Medicare benefits from them. So that's one way. The other way is this. You can actually go back to work. In fact, I had this happen just recently. I had a lady who had 36 quarters. And first thing I asked her, of course, are you married? And she said no. And I said, well, have you ever been married? And she said, yes. How long? The marriage lasted 6 years, actually, not 10. And so she was not able to go back to a spouse. So what we encourage her to do is to go back to work. And this is actually what she's doing presently. Why? Because a quarter is actually not 3 months. Now, I cannot get more than 4 quarters in a year, but I do not have to work a full 3 months to get 1 quarter. What I have to do is I have to make the minimum amount of money, $1,410 of taxable income, and that gives me a quarter. So if I need 4 quarters, as she did, we multiply that times 4, what does she have to make? $5,640 of taxable income, and that gave her her 4 quarters. So that may take you 1 month, 2 months, 6 months, whatever it takes to get to $5,640, and you picked up your 40 quarters. And so those with 40 quarters, no penalty. Those without them, if we can't move over into this column, then you are going to be subject to penalties. And so this group is never penalized, and this group could be penalized if their enrollment is late. All right, so that's the way that works. So this chart should make this very clear as to who gets a penalty. So if someone has 40 quarters or more, you'll never, ever be penalized whatsoever. It's going to be free regardless of when you take your Medicare. There's no penalty whatsoever, and your premium also will be free. Now, if we have 30 to 39 quarters, now we have to buy it every month. $252 a month, $3,000 a year right now. Now, that's why we were saying if we can get to 40, we'd like to move from this column up to here so we can have Part A premium free for the rest of our life. And so if we have 0 to 29, now we got to buy it for $458. And what I'm trying to teach is this group of people here, the ones that have less than 40 quarters, they're the ones that have to pay a penalty. So if they do not enroll into Medicare at retirement or at 65, if they're no longer working, then they will be assessed a penalty. And the way it works is this. For every year you go without Medicare Part A, when you should have had it, you will have a 10% penalty. And if I go without 1 year, I'm going to have to pay that penalty for 2 years. If I go without 2 years, I will pay a 20% penalty, and I will pay that for 4 years. So the penalties are in percentage, and they're always assessed to the premium that you would be responsible for. So it's applied to that right there. So I'm saying if you have 40 quarters or more, there's never a penalty assessed whatsoever. So the last question is, do you have to enroll into Part A? Well, are you working or are you not? So if you are retired, the answer to that question is yes, you have to take Medicare Part A and Part B. So if you or your spouse no longer working, you're retired, you must enroll into Part A. But for those of you that are still working, do you have to enroll into Part A? And the answer is no, you don't. You do not. Now, some of you may choose to do that, but you are not required to do that. And there's some consequences if you are still working and you take Part A. And I want to make sure you're clear on those two consequences. If you have an HSA, which means you have a high deductible health plan that has a health savings account attached to it, then if you do enroll in Part A while still working with an HSA, you must stop your contributions to your HSA. Now, your HSA money is still yours, but we can make no new contribution to the HSA once we take Part A. And there's a second consequence that rarely people hear about, and that is that some of you are going to be using a Medicare Advantage plan. And with Medicare Advantage plans will come a trial period. But if you take Part A, you're hurting yourself for a Medicare Advantage trial period by enrolling while you're still working. So those are the two consequences. So the question is, do you have to take while you're still working? And the answer is no. Now, if you were to talk to the Social Security office or Medicare, if you ask them that question, should I take Part A? They will say absolutely yes. And here's why. They always say, well, because it's free. Well, of course it's free. Why? Because you have 40 quarters. It's not free because you're enrolling in at this time. It's free because you or a spouse had the 40 quarters, okay? Second, they'll tell you there may be something that Medicare would cover that your work plan, your group plan at work would not cover. And that is possible. I see it rarely, but it could happen. But that's the second reason they tell you to do it. And those are fine, but here's what I want you to realize. I don't want you to enroll into Part A while you're still working because of the fear of a penalty. If you have 40 quarters paid in, you do not have to fear being penalized because it will be free regardless of when you take it. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.